Welcome, everybody. We have today a guest, Dr. Susie Gronski, who is a doctor of physical therapy, a certified pelvic rehabilitation specialist, as well as a certified sexuality counselor and educator. She's based out of Asheville, North Carolina. And at the end of this interview, we're going to give you the links to reach to her, even if you're not in North Carolina, and be able to take advantage of some of the resources that she has there. But Dr. Gronski, thanks for joining us today.
Well, thank you for having me, Andy. I'm really happy to be here.
I just want to ask you some questions because I know in your experience, you are working with a lot of men who have been through a radical prostatectomy, radiation therapy for prostate cancer. And I love your approach, a very holistic, a very not only psychological, but physiological approach to across all realms. But in our case, what we're focusing is on those patients who've gone through a radical prostatectomy. So if I may ask, the first question is, when you say a holistic approach, tell me what you mean by that.
So when we say holistic approach, really mean taking the person-centered approach, understanding that the person is more than just their physical body parts, but certainly encompassing the psychological, the social, the cultural, and the interpersonal aspects of their experience as a person living in their body and also living in the world around them. So all of those factors, as far as the human experience, are really important when it comes to anything that shapes or shifts our well-being and the way that we engage with the world.
And it's not a simple thing. It is so complex. And so when you say the ripple effect, that was another thing I saw you mention in another conversation that you had with a doctor. As I understand that, that is treatment for erectile dysfunction. Doesn't just cover erectile dysfunction, but it may also cover incontinence, bowel, urinary incontinence. Can you talk about what you mean when you say the ripple effect?
So if we're speaking specifically to a prostate cancer treatment and the consequences or sequelae of that particular treatment, we have to consider that there are several things that are going to be different for that person and how they're experiencing their body functions. Not only just their physical body functions, but also the emotional and one sense of self and identity related to what our genitals and function of our genitals mean for us. And that definitely does change as a consequence of the sequelae related to, for example, prostate cancer treatment. When we're talking about a prostatectomy, for example, and I have a model here that may be helpful to use in this example for folks in case we're not familiar with some of the anatomy. Just a brief 101 here. Everything in between our butt bones is called the pelvic floor, the perineum, and that encompasses the muscles, the nerves, the blood vessels, the veins, the lymphatic structures, the genitals, etc. If we were to look inside of the pelvis, you are going to see a bladder, a rectum that lives behind there. If I were to open the pelvis, for example, if we were to cut you in half and look inside like a book, what we're going to see here is the front, bladder, prostate, and rectum, and then the accompanying pelvic floor musculature that live here. During any prostate cancer treatment that may impact the neurovascular structures that support erectile function, for example, like the cavernosal nerves to the penis, which is often compromised in pelvic cancer treatment in general, whether it's radiation or whether it's actual removal of the prostate gland resulting in immediate neurovascular injury or damage. The individual is going to incur or experience sexual dysfunction. So that is definitely a number one thing. The second thing is also urinary incontinence, because when we're talking about the anatomy here, at the top of the prostate gland is a sphincter called the internal urethral sphincter. Now, looking inside the structures, that sphincter lives up here. When the prostate gland is removed, that internal urethral sphincter also is removed, in addition to the other accompanying structures like the seminal vesicles around the prostate. that removes a primary continence mechanism, which means that the reliance is going to be on the pelvic floor musculature and the external urethral sphincter, which is located or at the apex or the bottom of the prostate. So urinary incontinence is going to be a big deal for a lot of people, including men, right? So the first thing that guys want to take care of is the leakage problem, because having urinary incontinence not just impacts your pants and what's going on physically with wetness, but then it ripples into all aspects of your life: self-confidence, self-esteem, your motivation and desire to want to engage socially. You're constantly looking for a bathroom. Maybe it becomes burdensome because you have to carry continence care products with you. I mean, there's so many things involved when we're having difficulty with bladder control. And the last thing on your mind with that is also sexy time, right?
Yes.
You're not going to want to feel, want to engage sexually when you're just feeling so not confident in your body's ability to control bladder function. And one thing I will also note is that when bladder leakage occurs in some men who've had prostate cancer treatment, in particular a prostatectomy, something called climacturia, or leaking upon climax or during climax, might actually be a thing. And we really don't know what predisposes one individual to experiencing climacturia versus another, but we do know that it is a occurrence that may happen as a result of a prostatectomy, for example. And so it's important to have these conversations. It's important to have these conversations around, this isn't a permanent thing for the rest of your life, that there are things that we can do to support your rehab recovery, to educate around certain sexual resources or continence control mechanisms. For example, I'm sure many people, maybe they have, maybe they haven't, but using a pump actually has some preliminary research around continence recovery outcomes, that it may help with that. Doctors are not talking to their patients about what happens afterwards. What do we do afterwards when I'm faced with all of these physical and emotional challenges that are happening in my body? Who do I go and talk to? How do I even use a pump? That you won't believe how many men come into my office saying, like, I really do. I was told to use a pump. I have no idea how to use it. Who's coaching these guys? You know what I mean?
Yes, that is my passion. I think part of the reason why I've been with this company for 8 years, and I've had the pleasure of, being in doctors' offices. They'll call me in and say, meet with these guys, and I'll meet with 4 or 5 guys, sometimes 12 guys in a day, talk about the device. And it wasn't until I did that, the first, 30 men, I started to feel this common emotional vibe, which was uncertainty. I don't know what to expect. And sometimes their partner would be there with them. And then there's that emotional part of the sexual function, let alone the incontinence that you talk about. Now, another thing that you've talked about, and I love all of this, but you talked about performance versus pleasure in another conversation you had with a doctor, and maybe just get our mind off of the performance side of it and realize there may be some time of recovery from the surgery, and I've got to focus now on pleasure and just enjoying the sensuality. Can you help me understand that a little bit more?
Yes. So this conversation goes pretty deep, because in our culture, unfortunately, the messaging around men's sexuality has been, your penis is a machine. It should function in this way, be hard, rigid, whenever, however, doesn't matter what's going on in your life. As a human being, doesn't matter. It should just be functioning. And unfortunately, those expectations around sexuality and male sexuality in particular also is infused into what our partners think about what should or should not be happening in a sexual encounter. So, if you don't have an erection, does that mean you don't like your partner? Does that mean you're not turned on, or that you're not aroused? No, not at all. In fact, you can be very aroused and feeling very erotic and sensual and not have an erection at all, right? You can even climax and orgasm without ejaculation or having an erection. And so I think these negative sexual narratives in our culture really, really impact this messaging of, why hasn't it been pleasure first, always, right? Like
Yeah.
pleasure first, always. It's not your job to give your partner anything. In fact, you're sharing in a mutually pleasurable experience. You're supporting one another in your experiences, but you or your partner are not responsible for your own individual experience, right? So
Yeah.
I think that's really important to note here is that when there's this performative mindset and these expectations around what sex should look like and be, and really for a lot of us for a very long time have been, if you have a penis and a vagina, penis vagina sex, and that's really what it is intercourse, we're really, really selling ourselves short because there's so much more to sexuality and our sexual experiences than that one small piece of the experience. And I, by any means, am not minimizing that is very yummy for a lot of people. I get it, and it's an important aspect of one's sexual experience. And really, I think for men too, an identity, penis function is intertwined with one's sense of self and identity and masculinity, etc. However, it's much more broader than that, and having a sense of mental flexibility around our sexual experiences right from the bat, shaping and shifting and finding opportunities to experience sexual pleasure in other ways is going to help you regain and reconnect with your sexuality and satisfaction. In fact, there's numerous papers out there, qualitative studies that have shown that if partners, and we're talking about heterosexual experiences, men and women in coupleship, when they're embracing opportunities to find other ways, like, well, how else can I experience sexual pleasure and eroticism and sensuality, that they report greater sexual satisfaction after prostate cancer treatment than before.
That's
Can you
amazing.
believe that?
Yeah. I can still enjoy intimacy with my partner. I can
Mm-hmm.
also still do the work I need to do on the pelvic health front, the erectile function front. But at the
Mm-hmm.
same time, it's not one or the other. It's sort of this,
Right.
they're
Yeah.
synchronized, coming together kind of thing.
That's right. Like sexify your rehab. It doesn't have to be mechanical. I think that's often what, is the barrier for a lot of men in rehabilitation, post-cancer recovery.
Yeah.
It's because it becomes too mechanical. It becomes a chore. It becomes something I have to do. And it's like, well, how can we reframe that? Can your partner pump you? What if you're using injectable therapies or maybe a vibrator? Have fun with it. No one's really saying you can't have fun while you're doing
Yeah.
your rehab. So that's really that like fun, playful silliness. That's what's going to really support the flourishing of pleasure and desire and sexual appetite, especially when things feel so overwhelming after losing function. There's a lot we cannot understate the grief and the loss that encompasses one's experience around a loss of physical function, which is so intimately tied to one's sense of self.
Mm-hmm. It is such an emotional thing for men. And if a man comes to you and their partner, however that looks for you, the very things that you just said to me, I think are something that provides some encouragement for them. And it's going to be something they're going to have to walk away and think about and process and try to understand that. And what I always tell men when I am coaching around the device itself, around erectile function, is maybe the first couple of times, just so you get accustomed to the device, you might want to, kind of say, listen, here's what I'm going to do. I'm going to go to the bathroom. I'm going to try this and figure this thing out. Because as a man, we don't want to make a mistake in front of somebody else. But once you get to that place of being competent with it, then yeah, bring that partner in. And I've coached around that as well. Listen, either you can go in the bathroom and do it. And if that's what works for you, great. But it could also work that you bring your partner into it. And because guess what? They are well aware that you're trying to restore erectile function. And they're probably a big advocate for that. So why not bring them in?
That's right. Lean towards or turn towards your partner as an erotic ally, a friend.
On the pelvic health front, you showed that great model, and I love that. If you were offering some just suggestions for men, and I know it's something that's a constant process for them, but in terms of restoring pelvic health, and like I
Mm-hmm.
said, I've been in those meetings pre-surgery
Mm-hmm.
where they the practitioner said, when you come in to have your catheter removed, we're going to introduce you to the nurse who specializes in pelvic health.
Mhm.
Whether they did that or not, I don't know whether that is even something that was on their mind, but how do they really address that deep core issue that might then benefit some of the other things that we've talked about, the incontinence and the erectile function?
Absolutely. Great question. So, what I commonly hear, what happens is that men are given a handout after their surgery to say, here, do these exercises, AKA called Kegels, pelvic
Yes.
floor contractions. There isn't anyone that is checking their pelvic floor function to actually see if they can isolate and do a proper pelvic floor contraction. There are many mistakes that people make, men and women, when in literature, when they are told, okay, do a pelvic floor contraction. Upwards of like 90% of the population is doing them incorrectly in these studies.
Okay.
So it's important to have guidance around what you're actually doing because, and in particular for men, the muscles that are going to aid incontinence control are the ones that are actually supporting the penile urethra. Okay, so the muscles right here and that external urethral sphincter that I mentioned on the inside, like where the apex or the bottom of the prostate was. We have to kind of engage those muscles appropriately and elicit maximal voluntary contraction. So not just like a half contraction or, that kind of sort of thing. It's like, no, you got to really engage it. And when you engage it, let it go, right? So here's another thing is coordination, right? So squeezing and letting go, both are equally important.
Yeah.
And then progressing into function. So a lot of men will have complaints of exertional activities causing leakage or having difficulty controlling their bladder when they're coughing, laughing, sneezing, doing higher level plyometric exercises, for example, maybe walking or maybe getting up from a chair, for example. Those are opportunities where we actually infuse pelvic floor specific awareness and exercises into those activities so that their body can adapt to the loads being placed on them, the changes in pressure. That's what these pelvic floor muscles do. They aid in supporting and adapting to varying types of pressure demands throughout the body. And that includes sex. So that's my main, I think, pet peeve about, what happens after the initial kind of medical treatment is that we're really failing these guys in a way because we're really not honing in on how do I do these exercises? How often should I be doing them? And potentially prolonging their continence recovery because there is a lot of research to support that if you do your pelvic floor exercises sooner, you will regain continence control sooner than later. Does that make sense?
It does make sense. And it sounds like it's very doable. It's doable in the privacy of your own home. You don't have to go to the gym to strengthen your pelvic.
No, right. But you can do your exercises at the gym, which I would highly encourage people to do.
Tell me, like, how much of a commitment should a man expect to have to make each day, consistently every day, to do
Right.
the things that you're talking about?
Yeah, that's a really good question as well. So we really don't have strict guidelines around how much is enough. The pelvic floor exam, so a pelvic therapist like myself, from the baseline assessment, will assess how many can you do before you completely fatigue? Just like general strength and conditioning principles, right? If you're working on reps or working on load, it just depends on what that particular person is really struggling with and where we start. So we may start very simple because, lying on your back, for example, is gravity eliminated, which means you're not lifting your pelvic floor muscles up against gravity. That might be a good place to start, especially if it's difficult to connect the brain with the body and, kind of coordination and muscle awareness and proprioception. And then we progress to sitting and standing. But as soon as possible, I'm encouraging people to really challenge the pelvic floor in any standing functional activities, whether it's walking, stair climbing, etc. And you could pepper these into all of your activities that you're already doing. So it doesn't mean like you have to carve out a special time in
No.
your day to do these. Like if you're going to the gym, great, because guess what? General fitness after prostate cancer or any cancer intervention actually increases, improves, or mitigates some of the negative sequelae of having prostate cancer treatment. So like get in there, start moving. Something is better than nothing. I will say that, doing 8 to 10 repetitions in one set and then peppering in several of those throughout the day. Again, the more functional you can make it, the better it will be.
Functional throughout the day. If you're going to the gym, that's also great. Make that part of it, but it doesn't have to be, all right, I've got to go to the gym to work on my pelvic floor or my, improve my pelvic health. All right, Dr. Gronski, one other question. If you were to say to a man who comes to you, just to give them encouragement, the next steps to take. It sounds like you just did that with the pelvic health, which I appreciate. And I know that you are a proponent of the vacuum erection device as part of treatment post-surgery.
Yes. So I'd like to actually kind of piggyback off of what I was talking about for pelvic floor incontinence, because the other piece of advice that I like to give is certainly, as you said, with the vacuum erection device, very important. You're not having nocturnal erections at all. That is not happening. So you literally do have to take your penis to the gym. I would not take your pump maybe to the gym to do this. This is where you can do this in the privacy of your own home or with play, but having daily, at least daily, getting blood flow into your penis is going to be really important. It will help reduce with penile shrinkage. As we already mentioned, it will help with potentially continence recovery and sexual recovery, as far as helping your nerves and vasculature come back online and help kind of support the healing process. That said, I didn't mention, but I'm going to mention it now, that when you're doing your exercises for continence control, these muscles wrap around your penis. So they're going to help with the sexual function. So it's like a double. You're getting 2 for 1 here. Not only are you supporting the continence control recovery, but you're also going to enhance and support your sexual function recovery, because these muscles communicate with nerves that supply your penis. So not all the nerves to your penis are, hibernating here after this particular surgery or cancer treatment. No. We need to use the landscape that is offered here, as far as the sensory landscape and the vascular landscape here, to help support penile function. These muscles do that. They support an erection, they aid in ejaculation, and they also support the experience of orgasm. So super important to combine, as I mentioned, your exercises, but thinking broadly, like you're doing so much more than that. So other things to consider, you've mentioned nutrition therapy, definitely. In my practice, we're asking, what was life like? What was your sexuality like? What was your bladder, bowel, and sexual function like before surgery? What other health comorbidities are we up against that might be detrimental to your recovery, to the results or the success of the outcomes, right? So if we're dealing with, heart disease, peripheral vascular disease, diabetes, things like that are going to negatively impact sexual function, we want to make sure we're addressing that through lifestyle factors and also through nutrition therapy. Okay. And then also looking at any potential medications. So if there are medications that you're on that may have potential sexual side effects, of course, I'm not the individual that's going to be meddling with dosing or telling people to get off of meds, but I am an educator, and in conjunction with the nutrition therapist, we're looking at drug interactions with supplements. Sometimes a lot of men will go online and try to find supplements that help with bringing blood flow to their penis, etc. And unfortunately, it's like snake oil, because supplements are not FDA regulated at all. And a lot of them have a lot of negatively impacting chemicals on your health. So I would caution people before they go out there and just kind of throw spaghetti at a brick wall, is really make sure you have the guidance of someone like a nutrition therapist or your local pharmacist who can actually make sure that there are no interactions with supplements and or the medications you're taking that might negatively impact your sexual functioning. So nutrition, medication, exercise, and the mental, emotional aspects. I can't stress that enough. I think, this is this is a number one thing I hear actually in my practice of how difficult it is for men to really grapple with the changes that they're experiencing, and the fact that they feel that there's no support for them. Many of them will just share what's on their mind, like open their hearts and their minds into the therapeutic space we have here, because they feel that they can trust the provider. They feel that this is a space that they can lean into without feeling judged or shamed or embarrassed, and often for the very first time, and maybe even sharing what they're sharing in a therapeutic space with you and not even their partner or their friend. So I think it's really important, and that's part of the therapy process as well, is to support the mental, emotional aspects of that person's well-being. And that might be someone like myself who's psychologically informed. I'm not a psychologist. I do have my sex counseling knowledge and background and certification. However, if there are historical experiences and really someone who's really just feeling super stuck or depressed, that is going to negatively impact their sexual recovery in general and their motivation and sexual appetite and libido. So we want to make sure we're connecting that person with a mental health therapist. We have one in our office who works as a team, but there are also others, and in particular, sex therapists. Sex therapists are qualified psychotherapists who have extensive education and background in helping people with sexuality concerns.
Just that holistic, it comes back to that, the holistic approach to it, I think is a beautiful thing. And I thank you for that.
And there's one more thing I wanted to add as far as expectations around recovery, because I'm glad you're mentioning that, is we talk about sexual recovery and rehab in years, like a year, several months to years. It can be up to 2 years of this process of sexual recovery. And again, it's a combination of ingredients that are going to work for you, right? There isn't one cookie cutter approach, and that could be a combination of medications, like you're mentioning nutrition therapy. It's a little bit of everything, but it depends on what that person's going to need or want or has capacity or resources for to be able to do. And we just, again, support people where they're at and go from there.
I appreciate your time, and I'm going to link to your site. It's the drsusieg.com. That's the most comprehensive site that gets patients to where they can access you through some opportunities for therapy, whether it's the sexuality counseling, the mental health therapy, the pelvic health therapy. Any of those are available. They don't have to be in North Carolina to be able to reap some of the benefits of knowing you. And so there's the drsusieg.com. I'll put the link in our description, but also your YouTube channel, which has just blown my mind and expanded my whole thought process about so many things. So that's what drew me to you, and I'm so grateful for that. So we'll also link to that channel when we put this video up. Dr. Gronski, thanks for being with us. We're so honored to have you, and we just look forward to seeing what you're going to do with men, and not just in this space that we talked about, but across the board, men and women.
Thank you so much, Andy. Really appreciate being here.
I'm so glad you stayed through the entire interview. And if you would like to check out Dr. Gronski's YouTube channel, I'm going to put a link to that right here. And if you would like to go to drsusieg.com, I will link to that website in the description of this video. But we plan on doing more interviews like this, trying to gather as much information, get it out for those of you who are struggling with erectile dysfunction, whether you are post-radical prostatectomy patients, whether you are patients dealing with organic erectile dysfunction, whatever it is, we want to provide as much information as we can and support you any way we can. If you have questions or recommendations for other videos you'd like to see, you can write to us at education@timmedical.com.